Welcome to Smart Wellness Tips. Today, we are discussing a critical life-saving skill that every family member needs to know immediately. When a medical crisis occurs, time is not just money. It is brain tissue, memories, and the future quality of life. For our elderly loved ones, a stroke is often the most feared event, striking suddenly and changing lives in an instant. However, most people do not realize that the outcome often depends heavily on what happens before the ambulance actually arrives. Emergency responders are incredible, but they cannot be there instantly. The first few minutes are entirely in your capable hands. We call this the bridge of survival. Your actions can effectively bridge the gap between the onset of symptoms and professional care. Studies show that proper immediate response can significantly reduce brain damage and improve the chances of a full and healthy recovery. The difference between walking out of the hospital or needing long-term care often lies in those first 10 to 15 minutes. Today, we will learn exactly how to protect the brain during those critical moments using a proven technique called the 3-minute method. This knowledge is power. It transforms panic into purpose and fear into action. Let us begin by understanding the enemy. A stroke occurs when blood flow to a part of the brain is interrupted, depriving brain tissue of oxygen and nutrients. Brain cells begin to die in minutes, not hours. Therefore, recognizing the signs immediately is the first step to saving a life. Symptoms are not always dramatic like in movies. They can be subtle, like sudden numbness or weakness in the arm or leg. Watch for sudden confusion, trouble speaking, or difficulty understanding speech. These are silent alarms that the brain is under serious distress. Facial drooping is a key indicator. Ask the person to smile. If one side of their face droops, act immediately. Arm weakness is another sign. Ask them to raise both arms. Does one arm drift downward? This confirms a neurological issue. Sudden trouble seeing in one or both eyes is common. It might appear as blurred vision or total loss of sight. Sudden trouble walking, dizziness, loss of balance, or lack of coordination are warning signs that are often mistaken for simple fatigue. A severe headache that comes on instantly with no known cause can indicate a hemorrhagic stroke, which requires immediate medical attention. Remember the acronym FAST: face, arms, speech, and time. Memorizing this simple tool can help you diagnose the situation in seconds. If you see any of these signs, call emergency services immediately. Do not wait to see if the symptoms go away. Once help is on the way, you must utilize the 3-minute technique to stabilize the patient and protect their brain function. The first rule is to remain calm. Your panic will increase the patient's heart rate and blood pressure, worsening the situation. High blood pressure can accelerate bleeding in the brain or dislodge clots. Keeping the patient calm is a medical necessity. Step 1 of the technique is body positioning. We need to place the person in a specific posture to aid circulation. Ideally, place them in the recovery position, lying on their side. This prevents choking if they vomit and keeps airways open. Ensure their head is slightly elevated. This position helps facilitate venous drainage from the brain and reduces dangerous intracranial pressure. By using gravity, we reduce the pressure inside the skull, which is critical for protecting the brain cells from further damage. Loosen any tight clothing immediately. Collars, ties, belts, or waistbands should be released to allow for unrestricted blood flow and breathing. Physical restriction can increase anxiety and blood pressure. Freedom of movement for the chest and neck is vital for oxygen intake. Maintain a normal body temperature. If they are cold, cover them lightly. Extreme temperatures can stress the body's regulatory systems further. Stay close to them. Your presence is a powerful sedative. Let them know help is coming, and they are safe now. Step 2 involves controlled breathing. This is the most effective way to hack the nervous system and lower the heart rate. Guide them to breathe slowly and deeply through their nose. The goal is to slow down the rhythm of their breath. Nasal breathing is crucial. It filters the air and increases nitric oxide uptake, which helps dilate blood vessels and improve circulation. Encourage an exhalation that is longer than the inhalation. For example, inhale for 4 seconds and exhale for 6 seconds. Long exhalations activate the parasympathetic nervous system. This is the body's rest and digest mode, which naturally lowers blood pressure. If they are conscious and able to follow instructions, guide them with your own breath. Breathe with them to set the pace. This controlled breathing ensures that the maximum amount of oxygen reaches the brain tissue exactly when it is needed the most. Keep your voice low and rhythmic. Do not shout or ask complex questions. Just focus on the rhythm of the breath. Note, if the person is having difficulty breathing or is unconscious, do not force this. Just ensure their airway is clear. Step 3 is absolute stillness. We must minimize any unnecessary movement to conserve the body's limited energy and oxygen reserves. Advise the person not to move their limbs or try to get up. Movement consumes oxygen that the brain desperately needs. Every muscle movement burns fuel. By remaining still, we redirect all available oxygen and glucose to the struggling brain cells. Do not try to move the person to a bed or car unless they are in immediate danger. Wait for professionals. This stillness acts as a preservation mode. It is about hibernation and conservation until advanced medical support can take over. Reduce sensory input. Turn off the TV. Dim bright lights. And keep the environment as quiet and boring as possible. Sensory overload can stress a damaged brain. A quiet, dark environment reduces the workload on the neurological system significantly. Encourage them to close their eyes. Visual processing takes up a lot of brain energy. Resting the eyes saves brain power. To recap, position them on their side with head elevated. Guide slow breathing. Ensure absolute stillness. These are your 3 tools. Now, some critical warnings. Do not give them food, water, or medication. Their swallowing reflex may be impaired. Giving water or pills can cause choking or aspiration pneumonia, which complicates their condition and blocks their airway instantly. Do not use needles to prick fingers or earlobes. This causes pain, increases blood pressure, and wastes valuable time. When the ambulance arrives, provide them with a clear timeline. Tell them exactly when symptoms started and what you observed. Hand over a list of current medications if available. This information is vital for the doctors to choose the right treatment. Step back and let the professionals work. You have done your job. You have bridged the gap and given them hope. By keeping them calm, oxygenated, and safe, you have preserved viable brain tissue that doctors can now work to save. Recovery is a journey, but a strong start makes the destination much more reachable. Your quick thinking is the key. Stroke does not have to be the end of the story. With knowledge and preparation, we can rewrite the ending together. Please, take a moment today to save emergency numbers and discuss this plan with your family. Preparation prevents panic. Practice the breathing technique with your loved ones now. While everyone is healthy, muscle memory will kick in when needed. Share this video with your community. The more people who know these steps, the safer our elderly population will be. We believe that health is not just about doctors and hospitals. It is about empowered individuals making smart choices every day. If you found this guide helpful, please subscribe to Smart Wellness Tips. We are dedicated to bringing you practical health advice. Check out our other videos on heart health and emergency preparedness. Building a safety net of knowledge is your best defense. Protect the ones who built your world. A few minutes of learning today can gift them years of life tomorrow. Life is made of small moments. Let us ensure our loved ones get to enjoy as many of them as possible. Remember, you are the first responder. You are the guardian. Stay calm, act fast, and trust in your ability to help. Calm, position, breath. Keep these 3 words in your mind. They are the simple keys to unlocking a safer outcome. Never wait to see if it gets better. In the world of stroke, wait and see is the most dangerous approach. Send this link to your parents, your siblings, and your friends. You never know whose life this information might save. Thank you for taking the time to learn with us. Your proactive approach to health is truly inspiring and commendable. We hope you never have to use this information, but we are confident that if you do, you will be ready. Let us know in the comments if you have an emergency plan in place. We love hearing from our smart community. Invest in your health knowledge. It pays the best interest. Stay vigilant, stay educated, and stay safe out there. This has been a presentation by Smart Wellness Tips. We are here to guide you through the complexities of modern health. Please remember, this video is for educational purposes. Always follow the instructions of emergency dispatchers and medical professionals first. We are partners in your health journey. Together, we can create a safer environment for our aging population to thrive. Aging is a privilege. Let us protect it with wisdom and care. Thank you for watching and trusting us. Your family's health is your greatest treasure. Guard it well. We will see you in the next video with more tips. Take care of yourself and each other. From all of us here at Smart Wellness Tips, have a healthy day. Don't forget to hit that subscribe button and the bell icon so you never miss an update from our channel. Here are 2 more videos we picked just for you. Click 1 to keep learning about how to stay healthy. We appreciate your support. Your viewership helps us continue our mission of spreading vital health information to the world. This content was researched and curated by our dedicated team of health enthusiasts and medical consultants. Quality is our priority. Be safe, be smart, and always be prepared. That is the Smart Wellness Tips way. See you next time. Goodbye for now. Keep putting your health first, and remember that you have the power to make a difference. Thank you for being part of our community. Wishing you health, happiness, and peace of mind until we meet again. Stay tuned for our upcoming series on nutrition for seniors. It is going to be a game changer for your diet. This is Smart Wellness Tips, signing off. Thank you for watching, and please take good care of your precious health.